today we are going to introduce you to a new procedure. It's called FaceTite and neck tight. This is a minimally invasive procedure for tightening the lower face and the neck. So today we have a 59-year-old female patient, and her main concerns were sagging of the under eye and prominent nasolabial folds, as well as some minimal jowling, and also you can see she has a very minimal drooping of the neck. So she is an excellent candidate for this procedure, which is called neck tight or face tight. So this is a new technology. It's a what we call radio frequency assisted contraction of the neck and face tissues. It's a minimally invasive procedure where we just make small incisions beneath your neck and behind your ear, and we introduce the probe, and this probe is a radio frequency probe which causes heating of the tissues, especially the skin and the fascia, which causes contraction of the neck and face tissues. So this is very minimally invasive, so it can be done under even local anesthesia if patient is very cooperative, but in her case we are doing it under some IV sedation so that she is very comfortable, and also we can do the procedure in a very precise way. We will now shift the patient into the operating room, and we will discuss the rest of the details of the procedure inside the OR.
So for the neck, I'm going to mark 3 points, so one in the midline, and to define the jawline, we do mark on either side, just close to the ears. Then we are going to use Accutite to tighten the nasolabial, so we need some local here, and then we'll use Accutite again to tighten the under eye skin, and again some local for that. The same probe can be used even to tighten the brows, but for her we don't plan to do that today. So just a bit of local anesthesia. அவ்வளோதான் சின்ன இன்ஜெக்ஷன் ஊசி. This is the FaceTite probe, and we are going to connect it to the machine device, the platform. That's the Embrace RF. Just hang in here. So what you see is the Embrace RF FaceTite probe. You have a 10 centimeter internal probe with a sensor, and this is an external probe. So the radio frequency energy is passed from the internal probe to the external probe, and then we set the temperature here, so it's very well controlled. So we are going to set the external temperature 38, outside is 60. So first we need to put gel here, you need to put gel here. So we just put some xylocaine jelly on the areas that we are going to do. So this is a probe. So we do a bit of pre-tunneling so that the probe can move freely. So we do a little bit of pre-tunneling. We keep it superficial. And you can see the patient is very comfortable. There's no cut. So we don't cross this line. We don't want to cross the marionette line. So this has been a great technology for someone who does not want, who needs a, or who desires to have a facelift but does not want. So we start the procedure now. From the internal probe to the external probe, and you can hear actually a crackling sound where the fibrocepta is getting tightened. procedure done with Embrace RF, FaceTite and AccuTite probe. This is a great procedure, a bridge between non-invasive injectables like neuromodulators and fillers, which are used to give what's the so-called liquid facelift or non-invasive facelift, which last for 8 months to a year, and then you repeat the procedure, compared to a full-fledged surgical facelift or face and neck lift, where you have a downtime of about 2 weeks. There's going to be a small minimal scar around your the corner of your face or the neck. This is a bridge between these two procedures, where there's not going to be any scars. We made tiny little holes, and we use the specialized probes. This is a great platform called Embrace RF from InMode, where we use multiple types of probes. You have something called FaceTite, NeckTite, AccuTite, used for tightening different areas. We use the FaceTite to tighten your lower face and the neck, and we use the AccuTite to tighten the nasolabial fold and your under eye bags and under eye skin. So the whole procedure takes about an hour if all of these are combined. It can also be done to do an eyebrow lift by tightening your eyebrow skin and using the same AccuTite probe. It's done under local anesthesia with some IV sedation, but could be done purely under local as well, provided the patient can be a little more cooperative. It's a great procedure for a minimally invasive face tightening, where someone doesn't have too much of excess skin, because if you have too much excess skin, obviously they have to be removed, cut and removed surgically.